Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408-687-1899. Email address homeomedicine@yahoo.com. Anytime when you are suffering from any disease at any age, call me for your second consultation or second opinion about your disease or about your delayed progress. I can guide you according to the principles of nature. What's there? Why it's causing any problem for the cure? So it's free. It's a free. There is no consultation fee at this time, and you can call and you can get your informations. If you are far away from me and you cannot call me, you can just send me the emails all over the world from anywhere. You can send your questions in email. Homeo Medicine, HOMEOMEDICINE @yahoo.com. So anytime when you are having any problem, health related problems, and you want to discuss with me, you can call me or email me to get your answers. So let's come to the today's lecture. It is in English lectures, and we are starting the joints. As previously we have discussed, the trunk as a whole, the chest and the abdomen area, and abdomen area was discussed in two parts: the abdomen proper and the pelvic area, and all those things. What are the contents in different areas of the abdomen has been discussed, and mainly the problems therein are mostly discussed in short. In short, I'm saying, not it's detailed, because every organ has different diseases and every disease has a detail. That takes near about one lecture of this program. So we will start it later. But first of all, I have to complete a complete survey of this body. As previously we have discussed about the skull, the face, their organs, their functioning normal, and the normal day-to-day diseases, if anybody can suffer from that one, and after the neck, then chest, then abdomen, then pelvic area. So today, before starting the lower extremities, that is the lower legs, thigh, knee, your leg, ankle, foot, and fingers. So all these things, fist, that's known as fist. So all these things we will be discussing timely fashions and in these programs. And first of all, the thing is that all the structures are attached to each other by joints, and these joints are made up of some structures. There are different structures in different joints. There is a different movements in the different joints, and there is a different purpose of the different joints. So that is why there are different categories of the joints. And yesterday I discussed in Hindi what are the different characteristics of these joints. And today I'm giving this information to the English people, those who do not understand Punjabi or English. I know there are many more, and mostly I have noted that when I deliver my lecture in English, there are more people who are attending the class, and even after that, within 24 hours, till the next lecture starts at 5 to 6 p.m. in California Pacific time, they listen more. They listen more, and I'm happy for that one. That in whatever language you understand, you listen me. At least you are getting knowledge. So this is my main motive of delivering all these lectures, that you should get knowledge about your body and the functioning of this body, and how the life was started, and how this life was progressing, what were the hurdles in the normal go of life, and what are the causes mainly why this normal go of life is obstructed somehow, and that is caused the disease, and different type of diseases which are named and differently. Though there is a one disease, this is not easy, But even then, the different names are given to the those type of hurdles in the health, abnormalities in the health, with a different type of symptomatology, and they affect our vitality in a different way. So that different way affecting our vitality or the life force expresses by symptoms in a different way. So all these things we are discussing time to time, and now we are at the juncture of describing the lower extremities and especially the joints. And when we are discussing the joint, it does not mean that we are discussing only the lower extremity. We are discussing the whole joints of the body, so that we can know that what type of joints this body is structured for, how this body is built up, how the bones are jointed with each other, and even if the bones are not there, some other structures are joining with each other, and what is the structure where there they are joining each other. So let's come to the joints. Yesterday in my Hindi lecture, I told you that there are mainly the big division. If we say not the individual things, but a big division from all the joints. If we take it, it is called three divisions. Three divisions means the first one we can say the fibrous division. Those joints which are known as fibrous joints. The other division is the cartilaginous division. The third one is the synovial joints. And I will discuss with you one by one all the types of the joints. First of all, let us come to the fibrous joints. Fiber means fiber, means just like a rope, they have their threads, the similar type of fibers, okay, similar type of threads which are binding one joints. And that is why the name fibrous joints is given to those joints. And these are basically the compact joints which are not moving freely, or their movements are strict. Basically, this movement is known as fixed movement, no movement at all. If ever if ever anything has to move, the whole structure has to move. Otherwise otherwise the joints itself, joints from one bone to other bone, joints from one structure to other joints, they do not move individually. Same way, we can say Hanuman does not know what is the Sanjeevani Bhuti, and he pulled up the uh, whole whole thing and came to the Lanka. So in this way, these are simple just examples so that you can remember that one, what I'm saying and what I want to convey you. In this way, in this way, I can say these fibrous joints are the examples of skull bones. As you know, skull bone, our skull hold a big, you can say the big village is inside the skull bones. There are different organs, and I will describe each and every organs and their functions later on. But at this time, we are talking about the joints, and to make a globe of the skull, there are seven different bones: parietal, frontal bone, sphenoid bone, occipital bones. Okay, so occipital bones, parietal bones are two bones, sphenoid bones are two bone, four, and occipital bones are also two bones divided, and there is a one frontal bone. The seven bones are comprising to make a globe and their shape. Then how this shape is united with each other, that is very important thing. Just like if you have seen any open watch, if you have gone to the mechanics with your watch, something wrong, and they open your watch, and underneath you see there are some wheels, they are moving inside, and the wheels are moving the other wheels with their pointed ends in this way. but they are strict. But in watch, we see all those are moving. Whereas the structure, they are uniting with each other, or these seven bones I have told you, these seven bones are uniting with each other in that way, but that pointed ends of every wheel, they are fixed, not moving like the watch. This is the difference. They are not moving at all. Moreover, their movement is very strict movements. Only a little bit, only you cannot say that it is recognized movement, just like we can say that move from one side to the other, one direction to the other. It's not. They are fixed. And these joints are known as sutural joints as well. Sutures. They are suited with each other, just like the tailor shoe. The same thing is in the skull bones, and all the seven bones in their different globe type structure, they are uniting with each other with these fibers. These are the fibers which bind these nodes of each wheel into other wheels so that they cannot move. They are fixed. But still, sometimes, some of the diseases of the inside organs causes these sutures to open, causes these sutures to relax, though it's also still, again, it's a limited, not unlimited. It's a limited dilatation of our skull, just like in case of hydrocephalus. And yesterday I was describing the things, and I have to explain it in English again, the complete thing. The hydrocephalus is a disease because all the organs inside the skull, cerebrum, cerebellum, mons, medulla oblongata, all these are just like the houses in a village. And every house has its boundary. And every boundary is known as meninges, the coverings. All the houses, all the organs inside the skull, they are wrapped in a double layered membrane that's known as meninges. Double layer membrane has a little fluid inside it, which facilitates the movement of the internal organs. But outwardly, we cannot see that this skull is expanding, just like we chest. We see that when we breathe, chest is constricting, chest is expanding, chest is constricting in the same way, but we cannot see that in the brain because the outward structures are so strict. Outward structure is a fibrous structure, just like you do a welding. A metal to metal, it is welding, and when they are weld, they do not move it. But inside structure has their movability, but that is very limited movability, and that is within the skull area. And within the skull area means there is still a gap in between the skull area, because all the organs are having their boundary, their meninges, and the meninges are a covering, double layer covering, which has a little fluid, which facilitates the movement of expanding of these organs and constricting of these organs. But under some condition, just like we can say the hydrocephalus. Hydrocephalus is a dream. Hydro means water. Cephalus, skull. When there is excess water, more than normal water inside the skull, there are where that water is. First one, there are meninges, and I told you this is a double layer membrane on all the organs: cerebrum, cerebellum, mons, medulla oblongata. They all are covered by their own meninges, by their own glove, own covering. And but still, there is another thing in between these all organs. There is a gap. There is a space, just like you can see the streets in the city, in the village. You can say street in the village, and all the houses are passing through that street, going out of the village, going inside the village, in the homes and all that one. The streets, same. Those streets are known as ventricles. and four different categories of ventricles, means four different streets are there inside the skulls, and these streets are open just like in the village streets, but these streets are also having a fluid that is known as CSF, cerebrospinal fluid, and that cerebrospinal fluid may increase in quantity, may decrease in quantity, and that may expand, may force, basically not that, it can force to expand these organs, and the organs can force to expand the skull, and that is only possible if the sutures in between the bones are relaxed, and they are expanding, and then the head becomes larger because there is a excess of water once inside the ventricles, means the streets or inside the organs space where the cerebrospinal fluid is moving. The other, the meninges, the covering of all the organs, are having little fluids, and that fluid is increased by somehow. There are many more conditions. When I will come to the hydrocephalus, I will describe you salt retention and all that one, hypertension, many other things are with renal failures. All these things can cause this kind of effusions inside the body, and the same way this is caused inside the skull as well. So that water retained over there, and that water is more than normal, and when that water is more than normal and still continuously increasing, the condition which was causing this water to increase is still continuing to increasing, and ultimately they force. Definitely there will be symptoms at that time, definitely there will be pain at that time, definitely there will be a problem to the person at that time, and that condition causes or forces the skull bones joints, that's fibrous joints, to expand, and the head becomes larger. The big complication is this type of condition mostly happens during pregnancy to the children. It is very rarely that after the delivery or after we are adult even, under those conditions, it's a very rare condition that a person is having a hydrocephalus, that a person is having a tumor inside that one, that a person is having a subarachnoid hemorrhage or hemorrhage inside the brain that may cause to expand the skull bones. And this is the flexibility, and ultimately it's not without symptoms, it is with symptoms, with painful symptoms. There are other categories of symptoms I will describe later on for this one, because our chapter is to deal with the joints. So these are the joints, and hydrocephalus I'm talking about, mostly it happens when the child is inside mother's womb, it's not born yet. Under those conditions, this, because of the abnormal diet, because of some genital characters or deficiencies of the genetic side, it may happen that the water increased inside the skull bones, in the meninges or in the ventricles, and ultimately the bones expands. Normally normally why we consider this thing is a special thing to be noted, because mother's womb has a normal expansion. That maximum expansion is known as 8 to 10 centimeter, maximum 10 centimeter it can expand to allow the head to pass on during delivery. And it is assumed that at the time of delivery, in the more full term, when the child has spent 280 days in the mother's womb and coming out at the time of labor with the delivery, his head is not more than 10 centimeter. That is why it can pass from the mother's womb to be delivered. But under some condition, if there is a hydrocephalus within the pregnant periods, that will expand the head more than normal. Under those conditions, it will not pass normally because it is more than 10 centimeter in diameter. which is the minimum required diameter for a normal labor under those conditions previously. Now, not nowadays, because we have many more means to detect all these things before the delivery. Ultrasound and many other things. We have devices that we can check that the head is larger, and this is known as pelvic disproportion. Disproportion of the opening with the enlargement proportion of the skull. If it's a disproportion, it will not allow the delivery to happen normally. And now the medical science has advanced to the extent that we are able to detect this kind of deficiencies. These are known as the acquired diseases. Acquired diseases of the embryo, acquired diseases of the infants, or you can say the at the time of when it is not born, you can say fetus inside the mother's womb. So we are able to detect fetus abnormalities even before completion the 13th week of the pregnancy. Means after 3 months, 13 weeks, 12 weeks, 13 weeks, 1 week extra. So we are able to detect the abnormalities of the child fetus in the mother's womb when the pregnancy is of 13 weeks. And it means if we can detect the abnormalities of the children by ultrasound, by any other means, by hydramnios, by judging the abdominal girth, and there are many more means we the doctor knows about this one, and we can check it one. But ultrasound can detect it that how much it is enlarged, what is the diameter, whether it will be passing normally from the mother's womb or not at the time of delivery. So if it is not, then there are the medical science has generated another alternatives that's known as cesareans. And because normal way, it is not passing from the mother's genital organs, but previously what happens, mothers were dying, even the children were dying. That is known as stillbirth at that time, because mothers were suffering with labor pains. Normal periods 16 hours, but sometimes 2 days, 3 days. Girls were suffering from the labor pains, and it was not dilated to the sufficient extent so that a large head can pass from that one. And even there may be problems of the pelvic structure as well, but mostly we are talking about the joints of the skull. So that's why I'm describing that sometimes the head is so large that it cannot pass through the normal structure of the female at the time of delivery. And then, because at that time there were no means to detect this thing before the delivery, and children's and even the mothers were dying, and it was known as stillbirth, and mothers were dying with the pain, extreme pains at that time. But nowadays we are able to detect these kind of abnormalities at 13th week of pregnancy. Still there is a big time, because the full time of pregnancy is 40 weeks, 40 weeks. And whereas we are able to detect this kind of abnormality at 13th week, and there is a big time that we can correct all these things. And we can correct all the acquired problems, means which are because of the deficiency of the food, because of the deficiency or abnormality of the mother or of the developing fetus, except the genital characters, except the genetic problems. And we are able to correct that one. And second thing, suppose if it is beyond our limit, we could not control it. Within the period when we detect it, and within the period of 40 weeks, we are not able to bring the size of the head normal conditions. Under those conditions, we have developed the cesarean sections, and the child is taken out from the abdominal wall. And that's why I have already told you what are the structures of the abdominal walls, what are the muscles of the abdominal walls, what is their direction, how they move into the to bind the abdomens. And expert doctors put the incision according to the direction of the muscles, and they unite it after that one, and sometimes there remains no scar. Now the technique has advanced to that one. And most of the ladies now they are accepting this thing as a preferred way of labor, because no girl want to go through a pain of 16 hours. So that's why they prefer cesarean section. In this way, because previously mothers were delivering 10 children's, 8 children's, more than 10, 10 children's, and but now it's a limited. Any couple wants to not more than 2 or 3 children, mainly 2 children, or even the one sometimes. So in this way, there is no problem to have pregnancy, repeated pregnancy, up to 3 pregnancies, and then repeatedly going through cesarean for every delivery. In this way, in this way, we are saving thousands of lives with this detection that the head is enlarged, the sutures, the fibrous joints are enlarging because of the deficiency in the connective tissues over there, because the deficiencies of some salt or accumulation of some salts which is attracting the water. I will give you the details. I'll give you the details. That's why there's a big accumulation of water inside that one. And then the head skull bones are not uniting compactedly and they are enlarged. So these are the complications with this one, this type of joints. So I told you about this one. The skull bones are having fibrous joints, and those fibers are uniting with each other, and both things are similar, just like iron to iron, we welding it, iron to iron, similar type of structures are welding with each other. The same thing is here. So those joints which are having a similar type of structures and they are welded, like that is our skull bones, and the skull bones are the fibrous tissue. And all the fibrous joints are not movable. If ever, they are very limited movable. They cannot move much as the other joints are moving inside the body. Second, teeth. You might have seen teeth when they are fixed in the sockets. Teeth do not move. Whole jaw is moving when we bite, when we eat, when we talk. Whole jaw, maxilla, upper jaw, mandible, lower jaw, that as a whole move, not the teeth. Teeth are fixed in their sockets. This is also a fibrous type of joints. Cement of the gums attached with the bones, and they are compactedly just like welding. They are welded over there and they do not move. So this is another example of the skull bones. Sorry, the fibrous joints, just like skull and teeth. One other example I can give you: there are some bones in our body which are two bones at one area, two bones at one area, just like our arm. Our arm has two bones, just like radius and ulna. And radius and ulna, on one side, one bone is uniting with the carpal bones. On the other side, the other bone is united with the humerus. But these two bones are united with each other on 2 points. One on the wrist side, other on the elbow side. And those joints are also immovable. Means joints between the radius and ulna at the proximal end and at the distal end. Proximal end means upward and distal end means downward. They are immovable. They do not move. We move this arm, our bones, this compactly radius and ulna both moves, but they do not move separately. And in this way, we can say this is also one of the category of this kind, that they do not move. One another, I remember that one. Just I'm talking about one another. There are two bones in our leg, tibia and fibula, and tibia and fibula are united with each other. though the tibia is united, making the knee joints, and with the humerus and the patella upstairs and downward with the ankle bones. There are seven different ankle bones, and I will tell you. So these bones in between these are tibia and fibula, and tibia and fibula are tie up at the upper end as well as the lower end with each other, and those joints are also immovable. Radius and ulna, tibia and fibula, our teeth, and our skull bones. These are the major examples of the fibrous joint. Fibrous type of joints, they are like welded with each other. You mean, just like you can say that iron things are metaled, are welding with each other, and they are compact. After that, there is another category. There is another category of the joints that is known as cartilaginous joints. Cartilaginous joints has capacity to move not freely but to a limited extent. There are joints inside the body that they move up to a limited category, a limited to distance, a limited angle, but not freely. And just like you can say the joints of sternum with the ribs, these are connected with each other. And another joint I can refer to symphysis pubis. Our chest expanded. We breathe, expands. We exhale or inhale. At that time, this moves, and the joints, ribs are united with the sternum, the front bone, chest bone. They are united with each other, but their joints are just like in the socket. They are fixed. They are welded over there, but they have flexibility, and that is flexibility of a limited category. Just like you go for a military or for the police, and they check your chest. They say, okay, without expansion it should be 32 inches, and with expansion it should be 35 inches. This is what I have gone through. I know that one. So I am giving you the example. Same way our chest moves. Our chest moves, and it means the whole chest cage from the back side when it is attached with the vertebral column. In front, it is attached with the sternal bone. These joints are moving to a limited extent. That is why they are united with each other with the ropes, you can say. It's not welded. Ropes each other. The ropes are binding with the sternum to the ribs end, and that is why known as cartilaginous. Cartilage means they are not converted compactly. They are not compacted bones, just like the skull bones. They are not the same structure. They are not the same structure, but a different structure is binding to them. Sternum is a bone. Ribs are the bones. But a structure which is binding to these two things with each other is known as cartilage, is known as a different kind of threads, which is not actually the compact bone, but they are liable to be converted into bone. They are not compacted. They are liable to be become bones ultimately in the long life. Ultimately, when the old peoples are, these type of joints generally becomes fixed, and their chest does not move that much. In young age, in children's, adults, their chest moves more. But in old persons, their chest, that those cartilages, gradually, they are converting the type of bones, so they do not move at this time. That is why sometimes, mostly old people, they die from the respiratory problems. Heart attack is also one of the condition of that one in the old age, because they are not getting the oxygen they need. Heart is not moving because of the deficiency of the oxygen, and ultimately people die with pneumonia. Ultimately, the doctor says either heart failure or pneumonia, because it's not moving, it's not getting oxygen sufficiently. It is all because the joints are cartilaginous, but they are now converting to bones. Another example I can give you: in young age, you see that all the seven ribs are united with the sternum, and after the seventh, eighth, ninth, tenth, three ribs are not united with this bone, and there is a gap just in front of the chest. You see there is a gap, and that gap is known as the end of the sternum. Means end of the sternum is known as xiphoid sternum, XI, xiphoid sternum. And that xiphoid sternum is a cartilaginous joint. Means it moves more. It moves more because if there is a gas formation in the abdomen, if the abdomen is distended, it comes outward. It comes out. It more moves according to the movement of the chest. Ultimately, at the old age, after about 60 or 65, this xiphoid sternum, just like me, I'm 76, passing through 77. This xiphoid sternum at this age is converted into bone, or you can say becomes more harder. If not bone, it becomes more harder, and it does not move more much. And that also in the old age causes problem of the respirations and all those things which happen. So this is you can say these are an example of the cartilaginous bones. And also the big example of this kind is the symphysis pubis joint. I think since last 2 weeks, I'm continuously discussing the lower abdomen and area of the lower abdomen and the structure of the lower abdomens. That the lower abdomen is made up of three bones: ilium, the upper one, ischium, where we sit down on the chairs, that bone is downward, and the pubis. Pubis is uniting where your belt is tight and your buckle is there in front. That is known as pubis bone. And the joint of right pubis bone with the left pubis bone is known as symphysis pubis. And symphysis pubis joint is also of this cartilaginous type. It's also cartilaginous type, means it has flexibility, but to a limited extent. Just like I was describing the hydrocephalus and the previous structure, in the same way, it has flexibility because the nature it has more flexibility in the females, more than the male persons. Plus, it has more flexibility in the females between the age of 20 and 30. Within that period, it is having more flexibility. Otherwise, after that, if if a girl becomes pregnant within 20 to 30, within this decade, it's easy that she can deliver the child normally, because there is a flexibility. This allows the head to pass normally. If the head is normal, take it granted, if the head is normal, 10 centimeters, we consider the normal diameter of the female genital organs, which can pass, the head can pass through that one. There is a 10 centimeter or four finger dilatation. In a medical term, we call the four finger dilatations. And sometimes a little more is required. That depends upon the flexibility of this symphysis pubis joint. Even with the more pain, gradually, it can enlarge a little bit more, can allow the little bigger head to pass down. Even the breech presentation, when the head is not coming normal, Hip joint is coming normal. That's more larger than the head. It's very difficult. And this is the symphysis pubis joint, which allow even the breech presentation when the hip or any other organs except the head is coming out first. And this pelvic area allows that portion of the head that's known as presentation. So it allows the presentation area of the body to come out. It depends upon the symphysis pubis. And that is why mostly the doctor recommends to the girls, those who want to become a mother in later life, if ever you want to become a mother, please become before 30th year of your age. Because after that, this conversion starts or becomes more stiff. If once you are pregnant, you are delivering one child before the age of 30, no problem. No problem, it has already relaxed. But if your first delivery is 30th or after 30th, it will create a big problem for you for the normal delivery, because at that period it is now converting to a hard bone. That cartilaginous structure is converting to a stiff structures, and that may not expand the required expansion. Under those conditions, it may be a problem for the delivery. So that's why, under these joint structures, I'm advising to all my girls, my sisters, and all that, those who are thinking to become mothers, they should become at least their first delivery. After that, it's okay. After that, you can become a mother even after 40, after 45, whatever it is. But before that one, once you should get pregnant and once you should deliver a child before 30 years of age, before this symphysis pubis joint is becoming more stiff. Third type of example I can quote here about the this cartilaginous joint is the vertebral column. Our vertebral column in the backside. We describe it that in the initial stage, these are 33 vertebrae, 33 vertebrae, which are making the complete pillar of your vertebral column. And out of that one, we consider all the vertebrae had a different structure. All the vertebrae, but there are some structures common to all the vertebrae, that they are having openings for the nerves, blood vessels to come out from for the nerves and also to go inside, sensory fibers and locomotive fibers. All these things are coming from those holes outside and controlling the body at different areas. Just like there are 7 openings on right side in the cervical area, 7 openings on the left side of the area, and the 7 nerves are passing to control the arms up to the fingertips. And if someone says, oh my, this finger is not working, we as a doctor know that where is the problems. Where is the problem? Because we know that from where this junction is coming out. The same way, the thoracic are 12 vertebrae, and they are having 12 openings on the right side, 12 openings on the left side, and they are controlling the chest area, organs of the chest area, the same fibers, sensory fibers and locomotive fibers. Their sensation are delivered to the brain. Their orders are delivered back to the organs by the locomotives. What to do? So in this way, in thoracic area, and in the same way in the lumbar area. But after that, there are 5 sacral vertebrae, which ultimately joints and becomes one bone. They become one bone, and after that, after the sacral, there are coccygeal. They are the tailbone, you can say the tailbone. That a tailbone has 4 different vertebrae, but they are united into one. So in this way, they are not considered 33. They are considered 26. And because the different structure. Just the atlas vertebra, which is joining with the skull bone, has a different structure. The same way, some other vertebrae which are down there, they are different structures. But there are common features, just I told you about the openings. I had told you about the horns. I had told about the disc in between the vertebrae. Disc in between the vertebrae. And disc has also is having a neural canal throughout all the vertebrae, where the nerves are from the brain downwards go up to the coccyx, and also the cerebrospinal fluid, that fluid which is moving inside the brain and the ventricles and all that one, that moves into the vertebral column. And what I want to convey you, these joints are compact zone, compact type of joints known as cartilaginous joints. All the vertebrae are united with each other with the cartilages. And because in between there is a disc, they are like a spring. They can, you can say the shock absorbers. They are the shock absorbers. They can dilate, they can, just like you, like extend your body upward, then you sit down relaxed. So they are shock absorber type of joints, and these are also, all the vertebrae are united with each other with cartilages. And ultimately, remember, when you are young, you can move freely, you can bend down, you can bend back, you can bend right, you can bend right, left. But if you ask any old person like me, no, he cannot move like that one. He cannot move freely because all these structures are converting into the second stage. Though they are not completely the bone, but these cartilaginous structures are becoming hard, and their flexibility is diminished. That is why, there are problems, main problems, the back pains and all that pains in the old peoples, are they are suffering because the cartilages are becoming hard. That's a normal feature, and we have to bear with that one. And we are not moving, we are not playing kabaddi at that time. It's a difficult, and we are not doing gymnastic at that time because our joints do not allow. But if someone is continuously doing all these things since the beginning, and he continue it, do not stop that one even in the old age, yes, he can do that, but not to that extent which a child can do that, which an adult person can do that, can move his vertebral column, because it has a flexibility. But that flexibility depends upon the cartilage fibers, or ultimately they becomes hard. So I give you the examples of cartilaginous joints. These cartilaginous joints are having limited movement, just like the joints with the sternum, joints with the back, vertebral column of the ribs. With the breathing, they move. Second, I told you about the symphysis pubis. Mostly in the long bones, most of the joints are cartilaginous joints, and they do not move much. They remains intact up to a limited area. The same with spine, I told you. So all these joints are known as cartilaginous joints. So two categories I have described today in English, that is the joints which are made by fibers, means with the same type of structure, fibrous joints, and ultimately they are converted into the same structures, just like welding I told you. But the cartilaginous joints are made that the something, a kind of stuff is binded by the ropes, some different kind of ropes, and ultimately that ropes becomes tight, they are stiff. So that's why those, just like in the chest wall, just like the symphysis pubis, just like in the spines, all these joints are having limited movements inside the bodies. And the third category is known as synovial type of joints. Synovial type of joints, which are caged joints. You can say those joints are caged joints. They're all structures, they're all manufacturing things, whatever it is caged in a capsule under, this is the area of the joints, and above that joint there is a synovial membrane, and in between that, what makes the joint? That is, first of all, we need to make the joint is a bone. There are two or three or whatever bones, they are uniting. So these bones are coming over there, but they should not stuck with each other when they are moving. They should have a free movements. Then in between the bones there is a disc, and that disc itself has a fluid, but that fluid is different from the CSF, cerebral spinal fluid. It's not watery type. It's a little bit semi-solid type of disc, which contains a fluid which is a semi-solid type, and that remains in between the bones. That is synovial disc. First of all, I told you, just like we are going to the knee and we open the skin underneath, we will, before reaching to the knee, we will see the synovial capsule. That synovial capsule is surrounding all around the knee and will cover on upper side, it will be covered with the upper bone, on downside it will be attached to the downside bones, and there is no leakage at all. They are strictly stuck with this one, and in between that, in between it has elasticity, but in between that there are bones uniting with each other, but not uniting directly with each other. There is a disc known as, just like in the chest there is no disc, in the collarbone there is no disc, in sphincter there is no disc. But here I'm talking about the synovial joints. They are having, these are long bones mostly, these are bigger bones mostly, but they are freely moving bones mostly. So that is why they should not have frictions with each other, or they should not break easily. There is a structure known as synovial disc. First of all, synovial capsule, then there is a synovial disc in between the joints, and that synovial disc is made up of the same structure, but it has a fluid inside which is semi-solid type. It allows the joints to move freely in a young age, but ultimately as a person grows old, this elasticity is diminished. Then it is very difficult for the old people to move normally in this way or that way. When they wake up, rise up from the bed after sleeping, they are not like jump start like the young persons are jumping start. No, because that elasticity of the joints, mainly of the ankle joints, mainly of the knee joints, hip joints, they do not allow him the same type of jump start. They are not having that much elasticity in the old age. So this is all because the synovial capsule and the synovial, the disc in between the bone, is losing their elasticity. They are not having that sufficient elasticity in that area, and in this condition, it becomes difficulty in the old age to move freely the joints. So I'm talking about first of all the capsule. The second one, I'm talking about the disc in between the bones, and then the bones are uniting with the disc on both sides, and they are providing the flexibility to the joints to move on the right, move on the left, move on up, move on down. But after that, there are other different conditions that some of the joints do not move in all directions. My shoulder, it has circumdactions. I can go up, I can go down, I can go back, I can go front, and I can move it. This is known as circumdactions. Adduction, abduction, circumdactions, all these are the name of the movements which were used in the joints. But some of the joints has restriction, just like the knee joints. It cannot move upward front side. It can move back side. Our elbow, it can move front side. It cannot move back side. Shoulder joint, I already told you, it's a circumduction. It can move to all directions. Okay. So in this way, they are having different categories: synovial membranes are having different category. Two things are at a distance. In between, there is a disc, and over and above, to bind them, to keep them in a equal distance and a equal position, there is a capsule on that one. And then there is a fluid in between that capsules, which facilitates the movements of the bones, which facilitate the movements of the bone. That is why it's known as, these are known as synovial joints. Knee, elbow, most of the joints of the long bones, they are of the same kind. And out of that, there we have created another category, just like ball and socket. Ball and socket, and easy to understand. This shoulder joint, it is made up by taking this clavicle bone from the front side, and from back side the scapula bone, shoulder blade, and they are making a cavity which can hold the ball, just like this one. It can hold the ball. And the humerus bone, which is the our arm bone. This is known as arm bone. Okay, shoulder, below the shoulder. This is arm bone. This is forearm bone. So in this way, this bone has a ball, which ball is fixed into that joints. But that joint is already having a synovial type of structure. Synovial type of structure, I just explained to you how the synovial, it has a capsule, it has a disc. They do not stuck with each other, but they have free movements in this way. So these are known as ball and socket joints. In the same way, our hip joint, femur and hip joint socket is made up of three bones. I just told you the and this ischium, pubic, and ilium bones. They unite and form the socket. All the three bones are making the socket. And the femoral head, thigh bone, femoral head is fixed into that ball, and that's known as ball and socket joints. Some of the joints are having their restricted movements. Restricted movement means they can move up, down, but a limited area, just like the neck. I'm just talking these are known as pivot joints. Okay, neck hai, head hai. I can move this, I can move that. In this way, it's a limited type of movements, so they can do it. It's not just like circumferential, like the shoulder. It's not like the hip joints, but it has limited movements and the limited directions it can move, just like the joints of the neck, joints of the head with the vertebral column, all they are having the different joints. And after that, I think my time is over, but still there are some categories of the synovial. So everywhere when I say the synovial joints, they are having the same capsule, synovial capsule. They are having the synovial fluid. They are having the synovial disc, and also the bones uniting with each other. So this is the structure everywhere. It may be shoulder joint, it may be knee joint, it may be any other hip joints where there is a synovial membrane over there, synovial capsules over there. But there are some condyles, there are different carpal bones. Our carpal bones are having different kind of structures. So all these things I will describe tomorrow. And I think tomorrow is the time for the Punjabi program. So in Punjabi, because those who could not understand in English and they did not understood or they did not listen even the Hindi programs, they can listen to me tomorrow in Punjabi. So after that, I will go further, move for the structures of the hip joint. After that, the thigh. Okay, we will discuss side by side all these things. This is Gurdeep Singh Sandhu, your homeopathy consultant. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease at any age, you can call me for second opinion of your disease and all of your diagnosis. And even if you want to get treated with the scientific homeopathic approach, you can call me at 408 687 1899. God bless you all. We'll see you tomorrow in Punjabi program. Rubber up.